Hospitals here in Southern California are hitting a critical crisis point as the number of ICU beds drops to new lows. The ICU availability falling to 7.7% today.
The number raising concern about how hospitals are handling it all. KTLA's Jennifer McGraw is live in Pasadena with more. Jennifer?
Sharon, Mike, I spoke with the Hospital Association earlier this evening. That represents 180 hospitals across Southern California. They say there's not only a shortage in nurses, but now they fear that there won't be anywhere to put patients who are suffering with the coronavirus. New numbers across Southern California showing a dire need to slow the spread of COVID-19 as the number of ICU beds available dips below 8% regionally.
Like a speeding car approaching a cliff, if we do not rapidly change course, we are in jeopardy of catastrophic consequences.
In LA County, health officials say the number of patients hospitalized with COVID has increased by more than 300 people in just 2 days. It's not just LA, it's happening everywhere and in the Inland Empire.
We have adequate supplies because we've been bracing for the worst to happen, so that's an advantage. Now, we don't know how many more patients we're going to get.
Dr. Victor Waters is the chief medical officer of Dignity Health St. Bernardine. While the hospital is prepared, sadly, deaths will continue to rise.
We're talking about losing 3,000 people a day, and I remember the day of 9/11, losing 3,000 a day in that one day and how it impacted the world. And here we are in this condition.
Additionally is the need for healthcare workers. Another concern is losing those on the front lines.
As we get more and more patients in our hospital, it gets more difficult to support them with the proper staff. We're not at a break point like you may have heard and seen in New York City in Elmer's Hospital, but we are prepared for the worst.
Asking for people to hunker down until a vaccine is taken and accepted by the community. Dr. Waters is also concerned that there's a population out there who actually needs treatment outside of COVID, and maybe they're afraid to go to the hospital. He says if you have conditions in your life, if you have perhaps a lump or a tumor, that to get it checked out and not to wait and not to fear the coronavirus because they can keep you safe and separate at the hospital. Live here in Pasadena, I'm Jennifer McGraw. Send it back to you in the studio.